Let's put it all together now. So this patient has an ENFit tube. To this ENFit tube, I can hook it straight to my ENFit end of my kangaroo pump tubing. You may be used to kangaroo pump tubing having this white end. If it does still have that white end, you're just going to remove it. This end is now called the transitional connector. So I've got this ENFit end of my kangaroo pump, and it can hook straight in, or I can use a connection such as this ENFit Dale Ace. As you can see, it goes in super securely, holds really nicely and tightly. Into these, I can also put in an ENFit syringe. So ENFit syringes come in a couple different sizes. This is the big one, which you're probably familiar with, coming with the pistons canister. So I'm going to draw up my flush of sterile water, and it can hook straight into here on the Dale Ace, the ENFit Dale Ace. Or it can hook straight into the tube itself. What does not cross thread are any other types of syringes. So for example, my normal saline flush with a regular lure lock like I would use for IVs does not connect, nor does a slip tip syringe, or my traditional piston syringe. So none of those will connect. My enteral or oral syringe also will not hook into my IV, so they will not connect. If I have a patient with a traditional tube, it hasn't changed over to ENFit, they still have the standard, you're going to use the same transition connector. So with this transition connector, you can add it to your ENFit Dale Ace and then hook it very securely into your peg tube or whatever tube you have that isn't ENFit. I can also put a transitional connector straight onto a syringe. To do medications or flushes straight into the tube. So all you need to care for a patient that has a non-ENFit tube, a legacy tube, is this transition connector.
The last thing we need to cover is cleaning. Cleaning gets done at least once a day. It'll be on your brain at 2100. Here's its tiny brush. Take the clear plastic cap off. Take some sterile water, swish it around, get it good and wet. And what I'm trying to do is really clean this inside moat where formula and crush medications will live. So you want to get those out to prevent clogging and bacteria. So you're going to push it all the way to the bottom and then twirl your brush back and forth as you go around in a circle. You can re-rinse and do it again. This is a nurse only nurses can do this. And then once you're done with cleaning and it looks good, you're just going to hook it back together.
With these low dose tips that have that moat, so here is the moat, you can see that space here. You will need to get rid of excess medications, especially if this is a high risk medication or a very potent medication from the moat, because that can change the dosing. So if you're using a low dose syringe with a moat on a high risk medication, as you fill it, medication ends up in that moat. So you're going to need to get rid of that excess medication. There's a couple of methods. One is the flick. So just holding the cup, flicking it, you can see how that's gotten rid of the medication. The other method is a wicking method where you use a cloth, especially if the medication is really sticky. This may be the better method, using a clean cloth to really wick out and wipe off that extra medication. Either method gets that extra medication out. The large bore syringes like this that come with the piston set, especially if you're giving just whole volumes, they do not have a mode, and so you do not need to use those methods.